Hey everyone, my presentation is on major depressive disorder, also referred to as major depression. I will briefly cover the diagnosis, symptoms, prevalence, and impact. Then I will identify interventions by level of evidence and focus on two social work relevant interventions, which are behavioral activation and interpersonal therapy. Major depressive disorder is a serious mood disorder that affects more than emotions. It can affect thinking, motivation, physical energy, decision making, relationships, and daily functioning. Common symptoms include persistent sadness, hopelessness, loss of interest, fatigue, changes in sleep or appetite, difficulty concentrating, feelings of worthlessness or guilt, and thoughts of death or suicide. Depression is a problem because it can disrupt basic parts of daily life. Individuals may struggle with routines, staying connected to support systems, and other significant areas of daily life. Families may experience stress, caregiving responsibilities, safety concerns, and changes in the home. Communities are also affected through increased need for mental health services, healthcare use, reduced participation, and broader social and economic burdens as well. Major depression is one of the most common mental health concerns in the United States and globally. The National Institute of Mental Health reported that about 21 million United States adults have experienced at least one major depressive episode in the year 2021 alone. That represents about 8.3% of all adults. Adolescents and young adults are also significantly affected as well. These rates matter for social work because depression is not only an individual clinical concern, it affects family functioning, community participation, access to care, safety, and quality of life. This is why social workers need to understand which interventions are supported by the literature and how these interventions fit clients' needs respectively. In the literature, I identified several level A interventions such as SSRIs and SNRIs, cognitive behavior therapy, behavioral activation, interpersonal therapy, combined medication use and psychotherapy, electroconvulsive therapy, and repetitive transcranial magnetic stimulation. These interventions have stronger support from research such as clinical guidelines, systemic reviews, meta analysis, and randomized control trials. For this presentation, I selected behavioral activation and interpersonal therapy because both are evidence supported and can be implemented within social work practice. For level B, I identified mindfulness based cognitive therapy, exercise, and collaborative care. These interventions are promising, but their use may depend more on the client's treatment goals, symptoms, setting, and stage of care. For example, MBCT is often connected to relapse prevention. Exercise may be used as an adjunctive support, and collaborative care can help coordinate services across providers in general. For level C, I identified St. John's wort and light therapy for non seasonal depression. These approaches have more limited or mixed evidence. For example, St. John's wort may have some benefit for mild to moderate depression, but concerns remain about medication interactions and product quality. Light therapy may help some clients, but the evidence is less consistent. Because of this, these approaches should be used cautiously and should not be treated as first line interventions for every client. The first intervention I selected is behavioral activation. Behavioral activation helps clients increase engagement in meaningful, healthy, or necessary activities. This is important for major depression because depression often leads to withdrawal, avoidance, inactivity, and reduced positive reinforcement. In practice, a social worker may help the client identify activities they have stopped doing or have been avoiding. The client and social worker can then break those activities into manageable steps, schedule them, and monitor how activity affects mood. This may include hygiene, attending appointments, reconnecting with family, completing work or school responsibilities, or returning to activities that previously gave the client a sense of purpose. Behavioral activation works by interrupting the cycle of depression. When a person feels depressed, they may withdraw. That withdrawal may feel easier in the moment, but over time, it can increase isolation and reduce positive experiences. Behavioral activation helps the client rebuild routine and reconnect with life in a structural way. The evidence supports behavioral activation as an effective intervention for depression. For example, Eckers et al. And Uphoff et al. Support its effectiveness for adults with depression. And guideline literature identifies it as a first line psychological treatment. It also fits social work practice because it's practical, collaborative, and connected to the client's daily environment. A social worker can also consider barriers that may affect follow through, such as transportation, motivation, family responsibilities, work schedules, housing stress, or limited support in general. The second intervention I selected is interpersonal therapy, also known as IPT. IPT is a time limited intervention that focuses on the connection between depressive symptoms and problems in a client's social environment. These problems may include grief, role transition, interpersonal conflict, isolation, or difficulty maintaining support. In practice, a social worker using IPT helps the client identify a current interpersonal problem area and understand how it connects to depressive symptoms. For example, the client may be dealing with the loss of a loved one, conflict with a family member, adjusting to a new role, or feeling disconnected from other people. IPT helps the client improve communication, coping, and support seeking skills. The intervention is relevant because depression can affect how people relate to others. It may reduce communication, increase conflict, or cause the person to withdraw from people who could be supporting them. IPT addresses these issues directly by focusing on relationships and social functioning as well. The evidence supports IPT as an effective intervention for depression. Kujipers et al. Supports interpersonal psychotherapy for mental health problems, including depression. And clinical guideline literature identifies IPT as a first line psychological treatment. IPT fits social work because it connects well to the person and environment perspective. It allows a social worker to consider symptoms while also paying attention to relationships, roles, losses, family dynamics, communication patterns, and available supports in general. Moving on, although the literature supports several interventions for major depression, there are still important knowledge gaps. For example, one gap is the need for more research on long term effectiveness across diverse populations. Many studies show symptom improvement, but more attention is needed on whether clients maintain progress, prevent relapse, and continue functioning well after the treatment ends. Another gap is access and engagement in real world settings. Clients may face barriers such as cost, transportation, stigmas, limited insurance, provider availability, housing stress, in addition to other barriers that may cause some difficulties. This matters because an intervention can have strong evidence but still be difficult to use if it does not fit well in a client's daily life. More research is also needed on cultural responsiveness and real world social work practice. Depression may be experienced and expressed differently depending on culture, identity, family expectations, spirituality, trauma history, and community context. Future research should continue to examine how interventions can be adapted without weakening the core parts that make them effective. There's also a need to better match interventions to clients' needs. A client whose depression is connected to avoidance and activity may benefit from behavioral activation, whereas a client whose depression is connected to grief, conflict, or role transitions may benefit from IPT. Better matching would strengthen evidence informed practice overall and create more stronger outcomes. Overall, major depression is serious because it affects mood, daily functioning, relationships, work, school, family life, and overall well being. The literature supports several interventions, but behavioral activation and interpersonal therapy are strong options for social work practice. Behavioral activation helps clients rebuild routine, activity, and positive reinforcement, whereas interpersonal therapy helps clients address relationship stress, grief, conflict, role transitions, and social support. From an evidence based practice perspective, the goal is to use the best available research while also considering the client's needs, culture, preferences, and real world barriers as well. Thank you.